Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as Dad and a 35-year cancer survivor, available on Amazon. I'm going to continue on with my series, When the Body Tries to Warn You. We're up to part 3. And as usual, I want to remind you, if you have not watched part 1 and part 2, you want to do so that you have an idea where I came from and how I got to this point. Now, I had arrived by 5:30 a.m. as instructed for my 6:30 a.m. procedure to have at least one blockage, possibly more, to be stented via transcatheterization. Simpler put, fixing my heart through my leg. As opposed to doing this by open heart surgery, which would take weeks, if not months, to recover, this is why Dr. S said he would have me up and going in a week or two. My nurse's name was Heather, and she took me back to a holding area for me to get changed into a hospital gown, and then probably the most stressful part of my procedures, trying to get an IV into my arm. You want your best techs to have at me, not one who draws the shortest straw. Now, I've gotten really good at warning techs and nurses that I'm a hard stick due to my chemo history, that back when I was treated for Hodgkin's lymphoma, ports were not an option. So here's my PSA. Get a port if they offer it to you. It's not worth being stabbed repeatedly just trying to find a working surface vein. So everything was going smoothly and quickly. Heather would pop back in frequently to see if I was comfortable or if I needed anything, as in to calm down. I can't say what prompted me, but I brought up a totally unrelated conversation with her. That this was the first time I was having anything done since I was diagnosed with Hodgkin's lymphoma back in 1988. I had Heather's interest. I went through radiation therapy and chemotherapy and have been in remission ever since. Heather's face showed a little more intrigue, and she had something in her thoughts, and it was serious. I was not able to biologically have kids. My thyroid was messed up, and I had no spleen for my laparotomy, so doctors need to take extra precautions to make sure that I don't contract any infections. She wrote down that I was a splenic, which means without a spleen. Turns out this was an important detail, as with any surgery for me. Heather said, it's good to know because it's important. We will probably get some prophylactic antibiotics into you before starting. Okay, makes no difference to me. They were the professionals, and I had all my trust in them. At that point, I was given a sedative, and that's all I remember after that. So when the procedure was finished and I came to, I was groggy, and I was in a different room than what I went to sleep in. There was Dr. S and a friend of mine who had stopped by to check up on me. My head was woozy, so I know it was hard to focus on what Dr. S was trying to explain. Even with some new pictures and a drawing, I could barely make any sense of it, not to mention, take it seriously because I was that, woozy. Dr. S told me we were unable to do the stents as the catheter revealed extensive scarring to the left anterior descending artery, producing a 90% blockage. Just then, my friend, who happened to be a paramedic, also happened to recognize in plain English what the doctor had just explained medically. She blurted out, "Oh my God, it's a widowmaker." Now, Dr. S, the professional, interrupted, "Yeah, but we don't like to refer to it as that. Paul also actually has 2 other blockages to be dealt with as well, so I have him set up for an emergency triple bypass first thing in the morning." Now, of course, I kind of heard everything, but I understood nothing. Out of the word bypass, I got the word "by" out of it, and I just started babbling. Bypass. Bye-bye. Bye-bye. Bypass. At this point, all I remember the clock on the wall saying 3 o'clock. Dr. S left my room and I nodded back off to sleep. Now it was a little bit after 4 o'clock and I woke up not quite as groggy as I once was. On the table next to my bed were the 2 sheets of pictures and the drawing that I mentioned above. I remember vaguely what these things represented. Just then a nurse came in. Clearly, I was confused as to what was going on. I had pain in my leg from where they went in to do the catheterization and failed. The nurse recommended that I stay in bed until the cobwebs really cleared and were gone from my head, and make sure the pressure had gone down with the incision in my leg. I asked the nurse what happened and what was going on. She explained that when they went through my leg up to my heart, they discovered that my cardiac system had been so badly scarred from the radiation therapy I underwent back in 1989, making it impossible to implant the stents to open up the blockages. There was the worst blockage, the one that was 90%, the LAD, or Widowmaker, another one that was 40% blocked, and the third with the right coronary artery blocked 30%. I was set for an emergency triple bypass at 6:30 a.m. My head had been clearer from the anesthesia, but still, I was not reacting to this news the way that I should have been. I was focused on one thing, two things actually: my daughters. My daughters were only 3 and 5 years old at this time, but already they had been exposed to the situation of having friends who had lost a parent. Of course, even at their young age, and explained age appropriately, they still understood the loss of their friends experienced, never to see their dad again. And I began to cry. I didn't want to pass away. The nurse tried to console me, eventually giving me something to calm down as I was getting worked up over the situation. There was a lot that was going to happen over the next several hours, pre-op to be done, as well as to get my one and only meal in, as I would be fasting as of 8 p.m. for my early morning surgery. The last thing I felt like doing was eating. All I could think about was my daughters. Just like that, it started. In came the phlebotomist to draw blood, a wheelchair to take me for an ultrasound of my legs to see which veins or arteries could be harvested for my bypasses. Everything was happening quickly now. And with my head clearer, I was also paying attention now to everything being said around me. Up and down both my legs they went with the ultrasound wand and a standard thick Sharpie outlining my veins on each leg that they felt were suitable for the harvesting. Then it was off to x-ray for a chest pic and an echocardiogram. I got back to my room around 6 o'clock. Food was waiting for me. I didn't feel like eating, nor did I think it would make any difference, as the next day I was going to be without food anyway. Well, at least orally. All I could think about was wanting to talk to my daughters. I had to reach them sometime before they went to bed. I needed them to know what was going on, what to expect, and on a small child level. I had to be careful how I explained everything so that it would not scare them, not wanting to remind them of their friend's father who passed away from a heart attack. I got a hold of them just before 8 o'clock when they would be heading to bed. I told them that I was seeing doctors who wanted to fix me up. They're very nice to me and have a good plan that after the next day I will be good as new and that I will be home a few days after that. Not to worry about me. I was going to be fine. This was the second night in a row now I had not seen them, been able to hug them or kiss them goodnight. But I let them know how much I loved them and could not wait to see them again. The doctors would make sure of that. I held myself together while I was on the phone with my daughters and broke down immediately as soon as I hung up. Somehow, I was lacking the confidence that I clearly portrayed to my daughters, and a nurse came in and asked if there was anything she could get me, and I just said, I have one favor. If there was any chance that I could get a ride down to the hospital chapel. I'm not an organized practitioner of religion, but I have my faith, and I wanted to make sure surgeons were watched over, my daughters were being watched over, and of course, if there was anything that could be done to get me through my surgery. At 3 o'clock, a huge man who resembled Michael Clark Duncan, dressed in green scrubs, came into my room. He was there to prep me for my surgery. He would be my valet to the chapel and eventually down to the operating room. Just like Duncan's character in The Green Mile, he was a gentle giant of a man, towering over me. I was beginning to think at my age what I was about to undergo was having an impact on those taking care of me. 5:30 a.m. rolled around, and into the room came a gurney instead of a wheelchair. This time some extra help came into the room to lift me from my bed onto the gurney. It was go time. That wraps up part 3. Part 4 is coming up next. Until next time, this is Paul's Heart.